County of San Francisco press conference with Mayor London Breed and Dr. Grant Colfax. For Q&A, please state your name, outlet, and questions in WebEx chat. And now we welcome Mayor London Breed.
Thank you, and good morning. Thank you for joining us here today. I'm here with Dr. Grant Colfax to talk about just our case rate, our vaccination process, and specifically around the challenges with our vaccination process and supply, and also to provide an update on where we are with our schools. Today, the case rate is about 135 new cases per day. We have about 148 people who are hospitalized, and sadly, we have had 346 people die in San Francisco due to COVID since the beginning of this pandemic. Now, the case rate is down from its peak, but the virus is still in our community. So I just want to talk a little bit about what happened over the weekend. We know that in San Francisco, we were very excited that we were in the purple tier. So as a result, we opened outdoor dining and a number of other amenities. And for the most part, there were a lot of people who were doing their part. And unfortunately, there were some that weren't. The fact is, we are in a better place now based on what you all have been doing, especially over the holiday season. We are at a place where we were before Thanksgiving last year. The last thing we want to do is go backwards. And so it is so important that we continue to do our part. I know you're tired of hearing it. I'm tired of saying it, but we're almost there. And the ability to access the vaccine we know is critical. We don't have control of the supply, but we do have control over the number of locations that we're able to open citywide, and I'm really proud of the efforts that we put forward thus far. San Francisco has a network of sites all around the city. We have the capacity of over 10,000 sites where we can do over 10,000 vaccines per day. And that's pretty remarkable, and it's really exciting, especially once we get the supply. We know that we can get them distributed quickly as possible. I really appreciate those who have been vaccinated and have gone to places like Moscone Center and UCSF and the really nice notes and positive experiences that you have shared with us. Going to those sites and how friendly the people have been, how comfortable they made you feel, and how, of course, assured you feel knowing that you have been vaccinated. And I'm looking forward to everyone in San Francisco having that exact same experience. So thank you for sharing just your appreciation to the city, your appreciation to many of our healthcare workers, our volunteers, and a number of people that are out there helping to vaccinate people as quickly as possible. It definitely takes a village, and we've had a village of support with the Department of Public Health, UCSF, Kaiser Permanente, a number of other healthcare providers. There have been a lot of sites that you have been hearing about. The large sites at Moscone and UCSF has set up a site at the City College parking lot that we're working in partnership with them. But we do have community sites, including one in the Mission, the Western Addition, the Bayview Hunters Point, the places where the case rates are higher. And our goal is to try to meet people where they are and to try and really get to, of course, our healthcare workers, our in-home support services workers, and those who are 65 and older, who are sadly the most likely to die if they contract COVID. So I want to go to a slide just to give you a little bit of information about where we are, increasing as supply. The vaccines that we've administered, we're now averaging about 4,000 vaccines per day. And yesterday we basically reached a new high, 5,542 vaccines yesterday, which is pretty remarkable. It gives me hope that we are getting there and we're moving as fastly as we can. The next slide, vaccinating healthcare workers and people over 65 is really been our focus, making good on progress, but So what we see here is more than 30% of SF residents 65 and older have received their first dose. And we still, of course, have more to do because about 2.5% have received their second dose and others are scheduled. Citywide, 13% of San Francisco residents have received their first dose and 3% have received their second dose. This includes healthcare workers. And to be clear, this is based on data that we have in San Francisco. We know that there are a lot of San Francisco residents as well as San Francisco essential workers and healthcare workers that most likely are getting the vaccines in other counties. We are still struggling to get that data, so these numbers could potentially be higher than what we're seeing, and as soon as we have access to that data, we will, of course, share it with the public. The next slide, just to be clear on who's eligible now: healthcare workers, long-term care residents, people 65 and older. And I have some good news that starting February 26, San Francisco will move to phase 1B, Tier 1. And eligible people in that next phase include our education and childcare workers, our emergency services workers, including our police officers, our food and agricultural employees, and that's a really exciting thing that we're going to be able to expand the number of people who are eligible in the next 2 weeks, but to also reiterate that the vaccine supply is still limited. So for resources, on the next slide, you can sign up at sf.gov/vaccine-notify if you are interested in knowing whether or not you are eligible, and you will be notified when you are. You can make an appointment at sf.gov/getvaccinated. And for more information, sf.gov/COVID-vaccine or call 311. Now, I've had a number of senior citizens in particular who have reached out to me, and they have expressed frustration because they may not have access to the internet, and also with some of the systems, they don't have a cell phone to place a number in that. So we ask that you call 311, and we will provide you assistance to get you through the process. If anyone has a neighbor that's a senior, or anyone in any one of our programs where we serve seniors, we are doing everything we can to get people vaccinated and signed up. But let's take some responsibility here and try and help our seniors through this process. We're going to be doing a lot more outreach to get to many of those seniors who may not have access to the appropriate language that they need, as well as a cell phone and email, which I know can be a barrier to getting to our elderly population. So I just want to talk a little bit about the schools. I want to have what is, been a hard conversation. I know that it's been hard, not just for the children and the parents. It's been hard for many of our educators as well. The distance learning, we all know, it has been challenging, especially kids who are younger. But we know that every day, those teachers still show up. They set up their class lessons, and they do everything they can to hold the attention span of sometimes 5, 6, and 7-year-olds through a computer. I know they miss the kids just as much as the kids miss them. And I know that this has been a bit of a challenging subject to talk about, and sadly, very hurtful and emotional. I just want to be clear that I know this isn't hard, this isn't easy for any of us. It isn't easy for us to go back and forth and to be at odds with one another during such a critical time. When we first made the decision last year to shut the city down, that wasn't easy for me. I did it because I knew that it would save lives. It was based on the information from the Department of Public Health. I didn't understand completely how long we would be shut down or what it specifically meant. Many of us were just finding out more and more information about COVID, but we knew that we had to act fast. So we shut the city down, schools were shut down, a number of things had to occur, and none of us thought we'd be adjusting our lives for the past year because of this pandemic. But I must say that what I appreciate about the Department of Public Health is that they have been leaders. They have made hard decisions. I have had to support many of those hard decisions. They've made decisions based on science and based on data. And they have been probably one of the most conservative around our policies to reopen our city, probably more than any other public health department in the country. So I don't take lightly the ability to begin a process of reopening with the schools. The fact is, our Department of Public Health has put our public schools first. So when requested, because an application has to be submitted, we made analyzing the public schools our priority. In fact, in San Francisco, we know that there are about 113 private and parochial schools that are currently open. Our same Department of Public Health had to go in and analyze those schools for safety measures. And when provided the opportunity to do that for the public schools, we did that. We've cleared at least, based on the application process, 6 schools that can open. 6 schools including Alvarado, Glen Park, John Muir, Lawton, Sunset, and Cobb. And we're prepared to do whatever it takes to support our school district. To support our school district with experts from the Department of Public Health who can help provide us with not only what we need to do for the actual physical buildings, but how we need to protect the students and the educators and the staff and the administrators. That has always been our goal. I think we share that same goal. We all want to be safe, and we all understand that there are some teachers who are concerned about they may have an underlying health condition. They may have an elderly parent or grandparent that they take care of, and there's concerns there. We have a responsibility to listen and to address that. And what we've tried to do as a partner for the school district, at the very beginning of this pandemic, we were told that in addition to the money that we already give them in our budget, that they were still short. And so the city stepped up. We stepped up and gave them an additional $15 million. I stepped up and put a ballot measure, Proposition J, that the voters, you all supported, providing raises for teachers, Proposition J. We support our teachers. We support our educators. We want them to be safe. But we also know our children are broken. Last week, when I went to support a group of parents and students and teachers who were there as well at a press conference, not one kid smiled, not one kid laughed. Yesterday, I met with the Lowell High School students from the Black Student Union who've sadly faced racial discrimination in their school. And they're not the first Black students to experience this at Lowell. It's something that we need to address. But they, too, were kids who wanted to go back to school. Sadness in their eyes. I'm here to work to do everything possible to support the science and the data, to ask that we respect our public health department and the hard decisions they've had to make. There is no way that they would have cleared our ability to open public or private schools if it were not for the need to keep our students and our parents and our teachers and everyone safe. So I trust them, and I'm asking the school district to trust them. And I'm asking us to make some hard decisions. I'm worried that the tentative agreement proposed by the union will not get us to a place in this city where we will even open schools this year. I want us to be honest about what we will and will not do, or what we can and cannot do. Our children are suffering. There's no way I would have ever support using the legal system to try and get our schools open if we were on a path of moving it forward and if it weren't for the Department of Public Health telling us that it is safe to do so. We have to do better. We have to think about these children. And if nothing else, our elementary schools, kids who are in kindergarten, first grade, second grade, third grade. And I just also want to say that I appreciate the fact that there are so many people who are reaching out, especially a lot of teachers who are saying, I want to go back to school. I want to take care of my students. I'm worried about them. They're not showing up on the screen. I'm checking in with their parents. They're struggling. They're hurting. They want to be there for them. And this city is prepared to do whatever it takes to make sure that they can safely do that. We know this is hard. This is not about being divisive and choosing a side. This is about the leaders of this city choosing to work together, to put aside our differences and do what is in the best interest of these children. I would not be pushing it if I were not advised by our Department of Public Health that it is safe, and not to mention our community learning hubs with staff from Rec and Park, with help from Department of Children, Youth, and Family Programs. They've been open for months now, no major outbreaks. 15,000 kids in our private schools are back in school. We have examples, we have data, we have information. And what we need to do is leave the excuses out of the way. We have the ability to do this and do this now. But what we don't have right now is a clear plan and a clear timeline and assurance to parents that these kids are returning to school on a date certain. We can do better than this. So I'm continuing to make my appeal to the school district that this is exactly what I'm here to do, is to help, to support, to uplift, to bring together, and let's stop pointing the fingers. Let's just be better by doing better. These kids are counting on us. You know, this pandemic has tested us like never before. We have tried to protect people's physical health, but it has tried to tear us apart because of our mental and emotional health. And we can't let it do that. So many of us are struggling. We have a real opportunity to make sure that our kids who look sad, who miss their friends, who miss their teachers, who are ready to return to school, we have an opportunity to at least make some of that possible before the end of this school year. I am hopeful that we can get to a better place. And I am grateful to the people of San Francisco who continue to follow the health orders and to do your part in helping to make sure that people in this city are safe. With the vaccine, with our reopening efforts, with all that we're doing, the city is going to come alive again. Let's continue to do our very best to make sure that we don't lose something precious in the process, the heart and the soul of our children. With that, for more information, please visit our website or call 311. And at this time, I'd ask Dr. Grant Colfax to come forward and provide specific information from the Department of Public Health. Thank you so much.
All right, well, good morning. Thank you for joining us today. And thank you, Mayor Breed, for your leadership and commitment to our citywide COVID-19 response. As you all know, as a city, we've been responding to this virus for over a year now. And Mayor, your steadfast leadership and support continue to be invaluable. San Francisco, we have made significant headway in containing the virus during this recent surge. But as we are seeing nationally, there are still many unknowns, including new variants. We must continue to practice the safety precautions, mask wearing, physical distancing, and limiting interactions with multiple households. Please protect yourself and those closest to you by following all of the precautions. Together, we can continue to move forward and make progress. The vaccines represent the light at the end of the tunnel. While sufficient supplies are preventing us from vaccinating as many people as possible, as quickly as possible, we all have reasons to be hopeful. As the mayor just said, we have made great progress in vaccinating healthcare workers and those 65 years of age and older. And we continue to partner with healthcare systems across the city to build a vaccine ecosystem of vaccine sites focused on equity, speed, and access to meet the needs of San Francisco's diverse communities. Today, right now, this city has the capacity to administer over 10,000 vaccines a day. We could get 10,000 vaccine into arms a day. Right now, we are averaging just 4,000 due to a lack of vaccine supply. We just need supply to meet the demands and the capability of our vaccine infrastructure. And now I'd like to provide you with some data on where we stand with the virus. First slide, please. As you can see from this slide, the number of new COVID cases in our city fell rapidly after the peak of our most recent third surge. However, what concerns me is that new cases of COVID-19 have stopped declining, and there has been a trending up in the last several days. Now we are averaging 135 new cases a day. Now that's certainly much better than when we were at our peak surge and averaging 373 new cases per day. and that was just 1 month ago. But our case rate still remains higher than any other previous surge. Our current rate of 15.5 per 100,000 people is roughly the same as our peak summer surge. And remember, our goal is for an average of new cases to decline to less than 1.8 per 100,000. Next slide, please. As you can see in this slide, our hospitalizations continue to decrease from their peak just a few weeks ago. And this is certainly good news, as our ability to properly treat those affected with COVID-19 is a top priority. Additionally, our hospital rate is a key indicator of both the state and local health indicators for reopening decisions. Right now, with regard to intensive care unit beds, our capacity is good, with 28% ICU capacity, which represents over 90 ICU beds available across our healthcare systems in the city. Next slide, please. The mayor provided a significant update on the vaccines, but I wanted to share this map on the work of the Department of Public Health and what we're doing to vaccinate populations in our most impacted communities. Through the San Francisco Health Network, the health department's healthcare delivery system, we serve more than 100,000 people each year who are largely uninsured, underinsured, have Medicaid, Medi-Cal, or are served by Healthy San Francisco or other such programs. Many of the people in our system are in the southeast sector of the city, which, as you know, has had a disproportionate number of COVID-19 cases. This map shows where DPH, Department of Public Health, vaccines are being administered, and it shows that the majority of the approximately 1,300 daily doses that we are administering is in the southeast sector of the city. Next slide. Oh, sorry, that's it for slides. Before closing, I want to say a few words about variants. Now, variants are a natural part of how all viruses evolve. Some of the COVID-19 variants that have emerged worldwide and some that have been detected here in the Bay Area have the potential to spread faster. Now, across the nation, we have little laboratory capacity to detect variants. But studies do show that certain ones are spreading quickly in the United States and are likely to become common, if not the dominant strain. Now, I know that this can be a scary idea, and there is reason for concern. But we know what to do to slow the spread of these variants. It's even more important to wear those masks, socially distance, and avoid gatherings outside of your household. And it's so important to emphasize that vaccines remain our ticket out, including with variants. And I can't emphasize enough, if and when you are eligible and offered a vaccine, take it. The variants add uncertainty to this ever-evolving situation. But I can't stress it enough. Slow the spread of the virus. Take those prevention activities seriously. And I know it's been a year now. I know we're tired. We need to dig a little deeper to get closer to our ticket out, to get those vaccines into arms, to get to those 10,000 vaccines a day, so we can really turn this thing around. And our acting health officer, Dr. Susan Phillip, is here to answer specific questions about the variants. Look, we are all in this together, and together we will get through this. The vaccines are effective. They are safe. And I am hopeful and even optimistic that our supply will increase in the coming months. There is truly reason for hope and optimism on the horizon. We will bring back our communities and our economy the same way we continue to fight COVID-19, by working together. Thank you.
Thank you, Mayor Breed and Dr. Colfax, for your remarks. Before we begin the question and answer portion, we're going to take a moment to allow reporters to submit any final questions into WebEx chat.
Do you want to turn the camera off? Are we waiting, or the camera's off or on?
We can begin. Mayor Breed, your first question comes from Daniel Kerman, prompt 4. Do you support the city attorney's lawsuit against the school district in terms of, is this the best course of action to get schools to reopen?
I want to be clear that yes, I support the lawsuit, and if the possibility of getting schools open sooner without this lawsuit were in sight, if we thought that that was possible, there's no way that we would have pursued legal action. Unfortunately, this is where we are, and that's where we're headed.
Thank you. And a follow-up question, even if San Francisco moves to the red tier, schools cannot reopen until those teachers are vaccinated. Is there a plan to prioritize teachers alongside those age 65 and older?
To be clear, schools are open. There's 113 schools in San Francisco that are currently open with over 15,000 kids, and they've been open for months. As it relates to the clarity on the plan and the vaccinations, on February 26th, we will move to Tier 1B, and that will provide an opportunity for both educator, teachers, childcare workers to be vaccinated at that time.
Thank you, Mayor Breed. Your next question comes from Joe Fitzgerald Rodriguez, KQED. Mayor Breed, you spoke of the Black Student Union. Not to take away from the vaccine discussion, but can you talk about what support you've offered the Black Student Union and what you think Lowell High School should do to support them going forward?
Well, out of respect for the students, we had a lengthy conversation, and I want to make sure that they are comfortable with me sharing information from that conversation. But I did offer to help support them through this process, to help facilitate conversations with administrators and others. Sadly, what they are enduring is something that they should not be experiencing, and unfortunately, this is not a new challenge at Lowell. Several years back, other African American students have faced similar issues around race and discrimination, and it is definitely important that we respond to it, and to be clear, respond to it in a way that provides an opportunity for these young people to have an environment where they can learn and thrive just like any other student at Lowell.
Thank you, Mayor Breed. Your next question comes from Trisha Thadani, San Francisco Chronicle. Now that the federal government said it would reimburse San Francisco for much of its homeless hotel program, would you support HSH bringing in more people from off of the streets who may not be eligible for FEMA reimbursement? And if not, how do you propose the city deal with the many people still out on the streets who may not qualify for FEMA reimbursement?
Well, just to be clear, HSH is already moving people that are not necessarily qualified for FEMA reimbursement of hotel rooms. They are already moving those people off the streets. We've opened 2 new navigation centers. We've used our safe sleeping sites. Hopefully, we'll get to a point where we're able to repopulate our shelter system. And so this is not like frozen in time here. If you look around San Francisco, even with the challenges we have around homelessness, HSH has been doing an incredible job with helping to transition people off the streets and into either hotel rooms if they're eligible, but some of the other options that we have. Do we have enough to support everyone that's on the streets? No, sadly we don't, but we are moving forward with a strategy around homelessness to try and transition people not just into hotel rooms, not just into our shelter system, but transition them into permanent supportive housing units, and that's a part of our long-term homeless strategy in general.
Thank you, Mayor Breed. Your next question comes from Dan Kerman, Cron 4 News. Mayor Breed, you said that you do not support the current agreement.
I did not say that I do not support the current agreement. I want to be clear about that.
How can you get a reopening date when the teachers have trouble getting a vaccination?
Well, again, I want to be clear. I never said that I don't support the current agreement. The current agreement is just not clear. It doesn't provide any timelines and exactly what we're going to actually need to do. So I have a lot of questions, just like a lot of parents have a lot of questions about the current proposed agreement. But at the end of the day, as I said before, we have over 15,000 students that are in school now and have been for months, with 113 schools that are currently open. And these are people who have not received the vaccine. And our Department of Public Health says that without the vaccine, it is still safe to return to schools. But we do realize that there are people that want that assurance. And so fortunately, we're in a position where in the next 2 weeks, on February 26th, we will be able to move to the next tier 1B so that educators, teachers, and child care workers can actually get vaccinated. And I'm truly looking forward to that day.
Thank you, Mayor Breed. Your next question comes from Leslie McClurg, KQED. Given the tentative deal with labor unions, when do you foresee schools reopening?
Definitely not this school year. The fact is, again, when you incorporate the vaccine into the requirement, I understand this is something that's important to the union, but at the same time, we are doing everything we can based on supply to get the vaccines to people in San Francisco. And the fact is, based on the limited information I have about the tentative proposal, I don't think it's realistic that we can expect schools to open this school year.
Thank you, Mayor Breed. The next question comes from Christian Cafton, KTVU. San Francisco City Attorney has expanded the lawsuit to get kids back into school. One moment, please. We'll come back for that question. Christian Cafton of KTVU News. San Francisco City Attorney has expanded the lawsuit to get kids back into school. School board and union agree that the lawsuit is counterproductive. Is this the right tool to incentivize both sides to reach an agreement? And what would constitute concrete details for reopening?
If I didn't think that it was the right thing to do, I wouldn't be very supportive of doing it. The fact is, we have tried to be supportive, and you can look back in a number of press conferences that I've had to specifically talk about the support that we provided the school district, how we put aside, in many cases, many of the things that we were focused on in order to provide that support, in order to make our public schools a priority. We will continue to do that. But the fact is, it hasn't worked. And that's why I support our city attorney using the legal process to get to a place where hopefully it will make a difference. Not necessarily, if it makes a difference with negotiations, great. But more importantly, I just care about getting our kids back in school. And so whatever that takes, whether it's the legal system or negotiation, is fine. But I want to make sure that at the end of the day, that we are being honest with the public about what will happen. And ultimately, all the details, they don't matter if kids aren't back in school. And I think that's the most important part. What is the first day that we can expect to see a kindergarten, first grade, second grade, third grade kid return to school? And that's really the most important piece of what's missing here.
Thank you, Mayor Breed. The next question comes from Liz Heileman, Bay Area reporter. What will be the vaccine prioritization after phase 1? One moment. The next question is from ABC News. In light of the recent crimes in San Francisco, do you think Prop 47 should be revisited? Do you believe that it has played a role in crime in San Francisco?
I think, unfortunately, being in the midst of this pandemic, seeing, sadly, a lot of people lose their jobs has probably played a role in what we're seeing as it relates to crime. I do think that when we talk about crime and accountability, I think that there is, it's not an easy solution, because specifically when you talk about someone who's committed a violent crime against another human being, that's a different punishment versus someone who may have been their first offense, they stole something. They need to be held accountable, but at the same time, jail may not be the best solution, especially because ultimately we want rehabilitation, or we want support, or we want an option to try and get that person on the right path. So I think that there are various layers of accountability that need to be implemented in our criminal justice system here in San Francisco. Regardless of a proposition, it's what we're working with, and it's what we are in a position to try and work within, and mostly the goal is to make sure that people understand that they will be held accountable when they commit crimes in San Francisco. And I want to take this opportunity to just talk about some of the recent violent crimes, sadly, where people have, been murdered in our city. Elderly people have been murdered. And in those last 3 cases, our officers acted quickly and apprehended the suspects in those cases, and they are being prosecuted. We understand that after the fact doesn't matter. Those people are no longer with us. But at the end of the day, here in San Francisco, we are going to take an aggressive stance to protect the citizens of this city against crime, and we'll continue to do everything we can to do that, not just with law enforcement, but with our criminal justice system as a whole.
Thank you, Mayor Breed. We will now continue with questions for Dr. Colfax.
Thank you.
Of Bay Area reporter. What will be the vaccine prioritization after phase 1B? Will essential workers and people with health conditions be included? And Will the age group step down in 10-year increments?
So right now, we are focused on vaccinating people, healthcare workers, people over 65, and then on the 26th, as the mayor announced, we will move into the phase 1B of essential workers, which includes emergency service workers, food and agricultural workers, and educators. That's where we're headed now. We're still waiting for the state to finalize the next tiers of vaccination priority. We're following the state guidelines. The bottom line is we need more vaccine to get it into arms as quickly as possible. Our goal here is to vaccinate everyone in San Francisco as quickly as possible.
Thank you, Dr. Colfax. Your next set of questions come from Joshua Sabatini, San Francisco Examiner. Are the vaccines being equitably administered to San Francisco residents, or do you notice any disparities? And when will you release the race ethnicity data of those who have received the vaccine?
So we are working very hard, the data team, to establish a public-facing dashboard that will be updated regularly with regard to the race and ethnicity of people who have received vaccinations. As I mentioned earlier, equity is a core principle of our vaccine rollout. At the health department, as I showed, we are focusing on neighborhoods with the greatest concentration of COVID-19 to ensure that people in those neighborhoods who are eligible for vaccine have ready access. We have built a vaccine ecosystem where every door is the right door to receive the vaccine, whether it's a mass site, whether it's one of your neighborhood clinics, whether it's a pharmacy you can go to, whether it's a mobile team, a mobile site team that will be launching to reach people who are who need to remain at home. So we're working on this all of the above, every door is the right door approach to ensure that there's equitable access to vaccine. Very concerned about it. It needs to be a focus, and we are working to get it right as quickly as possible.
Thank you, Dr. Colfax. Your next question comes from multiple media outlets. On the question of equity, can you provide an update on how many residents within zip codes 94124 and 94134 have been vaccinated at the Bayview Health Clinic? Are there plans to make available more appointments across the city for hard-hit zip codes?
We are absolutely expanding. As vaccine becomes more available, we will expand access to vaccine in the areas, as I said, the neighborhoods, the zip codes where COVID-19 is most concentrated. So right now at the Southeast Health Center, we are able to do over 200 vaccines a day. We are also planning to launch in collaboration with Sutter Health a mass vaccine site at the produce market off of Bayshore Boulevard. So we hope to have that scaled up and ready to go within the next 2 weeks so that people have access to vaccine there as well. We're also establishing these neighborhood access sites last week at 24th and Mission in collaboration with the Latino Task Force and UCSF. We established a site there. We're also looking at establishing sites in the Bayview so people have access there. And I also want to emphasize that these are not, mutually exclusive sites. So just to give you a concrete example, at 24th and Cap, people were lining up to get vaccine. Thanks to the mayor's office, we arranged transportation for people to go to our vaccine clinic at San Francisco General Hospital. So people were able to access vaccine there, not have to wait in line at 24th and Cap. And then these mobile sites, these mobile teams, are going to have capacity each to do 150 vaccines a day. We will be launching these mobile teams very soon, so they can focus in neighborhoods where people have the greatest burden of disease and don't necessarily have the capacity to get to other vaccine options. So really every door is the right door, with a focus very specifically in the health department on meeting the needs of people in the zip codes where COVID-19 is most prevalent, where the rates are highest and people are most at risk.
Thank you, Dr. Colfax. Your next question comes from Michael Barba, San Francisco Examiner. When should the San Francisco Police Department officers expect to get vaccinated?
So emergency responders, emergency workers, service workers, including the police officers, are eligible in that Phase 1B essential workers. So that will be February 26th.
Thank you. Your next set of questions come from various media outlets. Is the city now receiving a stable amount of vaccine from the state, or is it still unpredictable?
Well, let me just emphasize that we are directly receiving, the health department is directly receiving only somewhere between 10 and 11,000 vaccines a week. So as I've said, we can do over 10,000 vaccine into arms right now a day. So, we hope the supply increases. We hope that it increases dramatically in the next couple of weeks, especially so we can vaccinate those 1B essential workers along with the remainder of people 65 and over who need to continue to get vaccinated. So we just need more. We just need more right now as quickly as possible. I am hopeful that there's more on the horizon, but we're ready to go. If I could get 10,000 vaccines after this press conference, we get it into arms in 24 hours.
Thank you, Dr. Colfax. Your next question comes from Maura Dolan, LA Times. Any thoughts on why virus cases have stopped decreasing and even rising in recent days?
So I think it's important to emphasize it's sort of a balance here. We are way below our peak during the holiday surge where we went over 40 per 100,000. We're now, again, between 15 and 16 per 100,000. That's still, as I said, about where we were at our peak of the summer surge. I think we don't have exactly one reason as to why this has leveled off. I do think we know that as we gradually increase activity in the city, viral cases generally do go up somewhat. So it's really a matter of trying to mitigate that, ensure that people still realize this is a very serious situation, that we need to socially distance, mask. Wear a mask over your face and your nose whenever you are outside of the house, and avoid gatherings, high-risk gatherings, whenever possible. I think we also need to also understand that with some of these variants, especially the British variant, that is predicted. The research shows that that's predicted to become the dominant strain in many parts of the U.S. By March or April. We know that virus spreads more quickly than what we call the wild type, sort of the original type of the virus. So there are multiple possible reasons. The key thing is we do know how to slow the spread. We do know vaccines are our ticket out. So we can do this. We just got to dig a little deeper so that we can all get the vaccine and get through this and reopen our city and have life go back to normal as quickly as possible.
Thank you, Dr. Colfax. Your final question comes from Joe Fitzgerald Rodriguez, KQED. Will the effort to reopen schools change the prioritization or rollout of vaccines in Phase 1B at all, considering teachers' desire for vaccination before returning to the classroom?
So as the mayor said, we have 113 schools open right now. Our public health guidance is that the schools can reopen without educators being vaccinated. We also share the priority that kids need to get back into school for the health of the kids, the health of the parents, and to close that learning gap. When we reach that Phase 1B, teachers will be eligible for vaccine. We want to make sure that we vaccinate teachers as quickly as possible. The bottom line is we need more supply of vaccine to make that possible.
Thank you, Dr. Colfax. Now, for questions on coronavirus variants, we invite the acting county health officer for San Francisco, Dr. Susan Phillip. Dr. Phillip, your first question comes from Aaron Alday, San Francisco Chronicle. What is the status of the new variants in San Francisco? Have you identified any of the variants from the UK, South Africa, or Brazil?
Thank you very much for the question. And I want to just take a moment to step back. And I know many of us have been hearing about variants, but just to give a quick primer. So when we're talking about variants, what this really means is viruses, as Dr. Colfax said, normally mutate randomly. This happens all the time. When the mutations sometimes cause them to be less fit or transmit less easily, we don't hear about them. Occasionally, randomly, there can be a mutation or a grouping of mutations that causes the virus to become more fit, to actually be able to transmit more, make people more sick, and that is what we are talking about when we talk about variants. These are random occurrences that then spread in our populations. So in San Francisco, we have not identified the variants of interest that have been nationally talked about. So these are the variants that started in the UK, which is known as B117, the variant that began in South Africa, which is B1351, and the variant that started in Brazil, which is called P1. And again, to be clear and to be very simple about it, this is different than the testing that we all know and think about now for many, many months, where we'll go and get a swab in our nose and get that diagnostic test. That is done in very many labs across the city and the region. The sequencing is actually the test that we need to do to find the variants. And what that is looking at the genetic material of the virus, of actually sequencing the virus genome to be able to see what the mutations are. That only occurs in a few specialized laboratories, and we're very fortunate in San Francisco that we have strong collaborations with our colleagues at UCSF and at Chan Zuckerberg Biohub, both of whom are experts in doing this type of work. But for context, as a country, we do not have the robust infrastructure to do this very, very systematically. So we are, by necessity, not able to sequence the 6,000 plus specimens that we are testing every day, and of those, the positive number, the 2 to 3% that are positive, not all of those can be sequenced because of the capacity and the specialty issues. So by definition, when we talk about variants, we don't have a complete picture across the world, across the country, in the Bay Area or in San Francisco. But we can get a glimpse of what we think is happening by how frequently we find different variants in the specimens that are tested. So from what we know, there has been the UK variant identified in California and in the Bay Area. And in fact, California has the second highest number of cases in the United States right now. So we have to assume that there could be that virus circulating in the Bay Area and in San Francisco, but we have not identified it. What Dr. Colfax said is so important. We know that the prevention methods that we've been talking about for a year are what will stop and slow the spread of these variants, even before we're able to access vaccine, which is, in fact, our ticket out, because the vaccine in studies have still been shown to be effective against these variants, and particularly against preventing against severe disease. So while vaccine is the ticket out, we have the ability in our hands right now to stop transmission of any virus, including variants, by masking, by distancing, by washing our hands. And I want to add one additional wrinkle to this, which I think is also really important and hopeful. The less virus that is transmitting and replicating, the less chance we have of having new variants emerge. So we talked about how it's a random mutation, but every time the virus replicates, there's another chance for a random mutation to end up resulting in a variant that would be of concern for a faster spread, making people sicker, or concern with the vaccine. So we have the power in our hands to not only stop the variants that we know now, but also to prevent new ones from emerging. So I would really urge all of us to take the standard prevention methods that we have. In public health, as a department, we are working to understand the types and distribution of variants, not only in San Francisco, but regionally and in the state. But in the meantime, we really ask everyone's help in trying to reduce the spread as we know how to do now.
And a follow-up question, what happens if the variant from the UK continues to spread in Southern California and becomes the dominant variant down there? Will that happen here too? And what is the level of your concern about these West Coast variants?
So what we know from the models and what we understand from science nationally is that the UK variant, because it does spread more quickly person to person, is likely to become the dominant strain in the United States by March. And so we don't have any reason to think that that'll be different in San Francisco. But again, we have the ability, as we have done time and again, to not necessarily let the models become our destiny if we are distancing, washing our hands, wearing face coverings all the time. And particularly as we are reopening and coming into contact with each other more, it becomes so important to do those things. There was a second part of the question about the West Coast variants. So this is a different strain of virus, which has been identified in California and in other areas on the West Coast. And this is called Cal.20C. And it has been identified in some outbreaks, not again in San Francisco, but it has been identified in individuals from San Francisco and in the Bay Area. But our colleagues at CDPH and at CDC are still evaluating all the data to understand if it is in fact more easy to transmit that variant and what all the implications are. So we don't have a clear understanding yet of the implications, but we do know it's transmitted the same way. We have no reason to think that the vaccine would not be effective against this variant or any others.
Thank you, Dr. Phillip. There are no additional questions.
Thank you.
This concludes today's press conference. Thank you, Mayor Breed, Dr. Colfax, and Dr. Phillip for your time. For future questions, please email dempress@sfgov.org. Thank you and have a nice day.